Stefan, it's great to see you.
Great to see you.
Yeah, we're in your hometown here.
Yeah, we love Houston. It's we've had our challenges this year, right, with the freeze and with COVID, but I think we're sort of on the back end of this.
On the back end. Give it time. Something else out of the universe will come and
True.
challenge us and make us stronger.
That's exactly right. We've learned a lot.
Well, it's good to have you here. So this is a really, this is an interesting conference, Surgical Disruptive Technology Summit, because it brings the clinicians really closer in. And usually it's around more general surgery, soft tissue surgery. We do have some orthopods in. And you're here, which is interesting because you're a power user with technology. And you also have, you're one of the early sort of pioneers in ambulatory surgical centers. And what is Innovate? 40,000 square feet? Is that how big it is?
Pretty close. Yeah, it's around 38,000 square feet, and that includes the clinic as well as the surgical facility and the physical therapy, and then we still have a little bit of space left over to grow to hopefully bring in some imaging such as MRI and CT scan. So.
And what, you know, you and I have known each other for a bit now, and I love our conversation around, and your passion around the economics of healthcare. And I know there are some clinicians and professionals who will do a head nod towards it, but you're evangelical about it.
Yeah, it's, you know, when I first started in this journey of becoming an orthopedic surgeon, I just liked to swing a hammer. And then as I sort of went through the different stages of growing my practice and then being in private practice and then being an employed physician, I got more and more interested in the business aspect of healthcare and just realized how much money is being spent in healthcare. And so there came a point where I said, well, there's got to be a better way of doing the same or better quality at a lower cost. And that really was the mission that pushed me towards building Innovate. And we've done well. I mean, last year, we saved Blue Cross Blue Shield over $1 million by providing, you know, the same or better care. We are one of the highest quality providers for Blue Cross Blue Shield, and it makes them extremely happy. And so that relationship with them is continuing to grow, where we are providing care for now their Obamacare plans and really helping them reduce costs there as well. So it's a good partnership.
Are they learning in their relationship with you, and are they able to take those learnings and translate them to other partners?
It's a good question, and I don't think that there's a lot of people out there that have that relationship and that philosophy that we do. And so I think they continue to focus on trying to find those partnerships, but in healthcare they're hard to find because there's just such poor alignment of incentives.
Yeah, and so when we talk about poor alignment of incentives, who are the primary stakeholders in that equation?
So the most important stakeholder is obviously the patient, but the patient doesn't pay for the product, so they really don't care what the cost of care is. And so who are the other stakeholders? There are the hospitals, the physician, the healthcare provider other than physicians like physical therapists and PAs. There's the payers, and there are all kinds of different incentives, whether you talk to Aetna, United Healthcare, or Cigna, or Blue Cross Blue Shield. There's such a heterogeneous incentive plan there. So those are one of the stakeholders. And then most important, other than the patient, is the employer, because they are the ones that end up paying the bills. And so there's really no alignment of incentives, and there's no transparency.
Yeah. And transparency meaning pricing and reimbursement. Correct. You can be in the same zip code, or you can be in the same zip code and have a differential in paying, or you could have the same organization in different zip codes and have a different pay plan.
That's exactly right. And the patient has no clue what the cost is. In fact, I always know when a patient tells me they have really good insurance, that probably means they don't pay much of a copay or co-insurance, and that means it's really bad for me because I'm probably getting hit on the reimbursement from the payer.
You had shared a story with me about how you have a vested interest and aligned interests, and you know, again, I started out saying you are an avid user of technology, and I think you do that because you love technology, but you've translated that towards better outcomes for the patient and better value back to the system.
Correct.
And you talked about a stat, and remind me exactly what it was, but infection rates coming out of your ASC. they were nearly zero relative to 2 to 3% of the market.
Correct. So we've done now 800 total joints in our surgery center with 0 infections. And that's a true statistic, and that's not massaging the numbers at all. I mean, because we have to report every infection that happens. And the reason, what I contribute that to is because we put a lot of extra stuff into the surgery center in order to accomplish that. For example, we have 30 air exchanges instead of 20 air exchanges in the operating room. We have UV light in the ductwork. We only use gloves that are individually tested. We put tape around the wrist. So there's a lot of little things that we did that could potentially reduce an infection. And it's hard to support that by data because the infection rate is very low to begin with. On average, the infection rate is about 1.5%, which is relatively low. And so in order to do studies to show that something will reduce the infection, you'd have to do 100,000 cases, randomized controlled trials, and that's almost impossible to do. So we took the philosophy that we're going to do everything that could potentially impact infection, and we implement that. From a technology standpoint, the reason why we're so focused on technology is because we feel that in order to reduce cost and maintain certain margins, we got to improve efficiency. We got to get rid of the waste, because there's a lot of waste in healthcare because there's no alignment of incentives. So if I do a case in a hospital, I don't really care what it costs because it's the hospital cost. But here, if we align incentives and we bring in technology, then we can become more efficient, and that really will help us maintain good margins. Part of my interest about this conference, because they talk so much about videoing in the operating room and improving efficiency and workflow and things like that, which in orthopedics is not done very well because generally in the hospital, the margins are so high, they don't have to be efficient.
Yeah, but that gets passed along to somebody in the equation.
Correct.
Which leads to our 18% of our GDP.
That's exactly right.
Growing.
Correct.
What would you pass on to other surgeons and other businessmen? Because you're both. You're a businessman and a surgeon. And what would you pass on to others in the emerging world? I'm watching now private equity come in. And when we start to look at the healthcare continuum, we're seeing major investment money outside of 510Ks and PMAs starting to come into the healthcare continuum, because it's one of the last two very large categories to invest in. There's either education or there's healthcare, because those are the big numbers that move the needle right now. Private equity is coming in on the real estate play. They're also coming in looking at businessmen like you who are clinicians who are incentivized and driven by a mission, and out of that everybody makes money and a fair profit. What would you say to other peers of yours who have the choice to make over the next year, 2 or 3, what they should be considering and why they might want to look at your model?
Yeah, probably the one thing I will tell everybody is keep an open mind and don't be afraid to try something new. When there's an industry that generates 18% of GDP, there's a lot of opportunity. And everything you do, focus number 1 on patient care, and number 2 on how to reduce healthcare costs, because it is an unsustainable model. And if we are not a good steward of the dollar we spend for healthcare, we will run out. I mean, it's inevitable. So we just have to reduce the healthcare costs. And so, keep an open mind. Try to be an entrepreneur. Don't get wooed by the offers by big hospital systems. Well, they'll pay you, $350,000 for your first year, so that you can collect a paycheck. Go into medicine because you went into medicine to be a doctor, but also, be a good steward of a purpose-driven life.
And do you look at each of your teammates differently when you're interviewing them versus if you were going to hire them in a hospital?
Oh, very much so. I mean, when I interview a physician, I focus very hard on the fact that we're purpose-driven here, not financially driven. And when you look at conscious capitalism, the concept of purpose-driven businesses, they end up doing better than anyone else. So, and that's my philosophy. And, eventually I'm sure the payback will be nice, but that can't be your number 1 motivation. And you get both types of physicians that you interview. They're the ones that are just asking, what am I going to get paid? And if that's the conversation and that's where the conversation goes, that conversation is fairly short. If I interview a physician that is more intrigued by what we're doing and how did you do that and how did you learn about this and they're interested in what we've done, yeah, that's a physician that I want to bring on the team.
You're on the leading edge of a lot of technologies. I know you use some very progressive robotics. You also use telehealth in your Innovate facility. We spent time down there with Nadine, and I know the Think robots are in there and other robots. And you also partner with implant players, and so you're very particular about what you bring in and who you bring in inside your walls at Innovate. How does that work out, and how is that different than a doc in a hospital?
Yeah, so one of the biggest frustration in a hospital, if I wanted to use a new implant company that's currently not an approved vendor, you know how long it takes to get a vendor approved? A year. Even if the implant cost would improve their margins, it takes an entire year for that vendor to be in there. You know, how can you move the needle in technology if it takes that long to get anything into the hospital? And so at Innovate, you know, we make decisions by committee meetings in the hallway. You know, there are 3 people that make the decisions, and we say, look, let's try this and let's do it. Now, at the end of the day, we have to be safe and we have to do what's right for the patient, so we would never jeopardize that. So we have also the opportunity to do cadaver workshops, and so we use it on the weekend where we, you know, whether we do sawbones, cadaver workshops, where we test some of these new devices before we would even consider bringing it in. We do that, and so, you know, my frustration is it's never quick enough, and I'm sure you're very similar to that. It's, you know, why can't it be today? Why do they say it's got to be tomorrow? And so that's, I think, part of this sort of incubator that we feel like at Innovate, where we can partner with people like with Proximie. And if I try to get Proximie into the hospital, again, it would take a year. It wouldn't happen. You know, I met Nadine last year, and, you know, I think we literally decided to do a Proximie live broadcast, and within 48 hours we did one. And I think the first one was with you.
It was out of our studios.
So it was crazy in how quickly we were able to do it. And then, so for somebody like me who is more on the innovative side, you know, I want to have access. I want to try it. I want to do this.
And the decentralization of healthcare. So we have become accustomed to, or at least until now, that big building that's a factory in the middle of town, and it's where we bring all the sick people, not just the very sick people. And now we're starting to see the ASCs open, especially in orthopedics, which seems to have the highest adoption rate. But then we also see, you know, these emergency care centers starting to pop up. And then with COVID, we saw home health become empowered. What are your thoughts, thesis, philosophy on, is that helping or hindering potential ultimate standard of care to the patient?
It's a good question. I think if there's more players, the player that does well for the patient hopefully will float to the top. We have to have hospitals, and so I am very conscientious of that as well, because we can't be that business driven where we drive all the high profit stuff out of the hospital and then the hospital bellies up, or we get to a socialized medicine status where hospitals are very poor quality facilities. So we have to continue to work with the hospital systems to make sure that they maintain, you know, the revenue that they need in order to take care of the people that either don't have insurance or are very sick and so forth. But you know, innovative models need to come to life in order for us to manage this healthcare crisis from an economic standpoint.
It's always fascinating to chat with you about this. The ASC model that you have is amazing. I hope others look into it. Innovate, I-N-O-V, the number 8. It's one of my workout shirts, the one you gave me. I use it in the morning, so thanks for that. That's a great rash guard. Yeah. And I know that you and I are in a panel tomorrow morning, and I'm excited about that because we have multiple stakeholders in that.
Yeah, and hopefully we can continue the conversation. And that's really what it's all about, right? We need to talk about it. We need to get in the same room. And when I first started Innovate, I always said, you know, I want to get everybody in the room and figure out, you know, what's your pain, what's your pain, what's your pain, and how can we work together to align incentives to build a better mousetrap. And It's all about communication. It's all about working together to do better. And ultimately, that's, you know, we're all supposed to be servant leaders, and that's what we need to be.
Agreed. Love your mindset, my friend.
Thank you.
Well, that's a wrap from SDTS in Houston. With Stefan Kreuzer, I'm Joe Mullings. Be well.